Have you ever paused to wonder why hundreds of families are waking up without a roof over their heads? By mid-2024, the latest count shows over 1,000 Mississippians living without stable housing, nearly half of them sleeping in tents, cars, or abandoned buildings. Parents juggle multiple jobs yet still fall behind on rent. Veterans who fought for our country now sleep under overpasses. Children miss school because their families can't find a safe place to stay. From Jackson's freeway encampments to rural hideouts in the Delta, this crisis spares no county. Shelter beds fill up within hours, leaving hundreds stranded each night. Now, let's cut to the facts and figures. Here's the hard data on the current state of homelessness in Mississippi. Current state of homelessness in Mississippi. In the annual point-in-time count on January 26, 2024, Mississippi documented 1,041 people experiencing homelessness, a 14% rise from the previous year. Of those, 486 individuals, nearly 47%, were unsheltered, sleeping in vehicles, tents, or other places not meant for habitation, while 555 people, 53%, sought refuge in emergency shelters and transitional housing. Single adults accounted for 874 of those counted, and families with children made up 167 heads of household, representing 274 children, a 45% increase over 2023. Older adults over age 65 numbered 210, a 26% jump that underscores how rising housing and healthcare costs strain fixed incomes. Unaccompanied youth under 25 totaled 44, and 40 veterans were recorded, marking a 9% decline in veteran homelessness. The chronically homeless population, those without a stable home for a year or more, or cycling repeatedly through shelters, fell 14% to 180 individuals. Despite targeted successes in reducing chronic and veteran homelessness, the surge in unsheltered numbers highlights severe systemic pressures, a scarcity of affordable housing, an underfunded shelter network, and sparse social services in rural counties. From the tent encampments beneath Jackson's freeway overpasses to hidden camps along back roads in the Pine Belt, residents face extreme weather, health risks, and isolation. How equipped is Mississippi's social welfare framework to catch every person before they slip through the cracks? Social welfare and support systems. Mississippi's social welfare framework is a patchwork of federal programs, state initiatives, and local nonprofit efforts. At the helm is the Mississippi Home Corporation, administering emergency housing vouchers designed to alleviate immediate risk of homelessness. These vouchers cover security deposits and a portion of monthly rent, theoretically creating a buffer for families teetering on the edge. Yet in practice, eligible households often face waiting lists that stretch for months. Budgetary constraints and administrative hurdles mean that the most vulnerable, those with unstable employment or lacking formal documentation, slip through the cracks. What does true compassion look like when budgets are tight? Complementing these vouchers is the Continuum of Care (COC) network, an alliance of government agencies and nonprofit organizations that coordinate services ranging from mental health counseling to job training. COC meetings bring together social workers, housing experts, and law enforcement representatives to map resources and identify gaps. In communities where COC operates effectively, drop-in centers offer stable mailing addresses, and case managers work one-on-one to navigate bureaucratic obstacles. This approach embodies the housing first philosophy, securing a roof before expecting individuals to tackle issues like addiction or unemployment. Yet outside larger cities, the COC presence is minimal, leaving rural counties with little. In Jackson, a pilot tiny homes initiative offers a glimpse of innovation. Donated land hosts 60 compact dwellings, small, insulated cabins equipped with utilities and communal areas. Residents pay nominal rent, attend regular counseling sessions, and agree to personal development plans. Early reports indicate these tiny homes foster a sense of ownership and stability, reducing recidivism into homelessness. Private donors and local contractors contributed time and materials, demonstrating how partnership models can accelerate progress. Could cooperation between agencies deliver results where individual efforts have fallen short? Faith-based organizations also play a pivotal role. Churches in Biloxi, for instance, open their doors nightly during winter months, providing hot meals and a safe space for up to 50 guests. These informal shelters operate on shoestring budgets, relying on volunteers and donated supplies. While commendable, they lack the consistency and oversight needed for long-term impact. Critics argue that without a formal framework, such shelters risk perpetuating dependency rather than fostering independence. Across the state, mobile outreach teams travel to encampments, offering hygiene kits, medical checkups, and referrals. Staffed by nurses and social workers, these teams serve as the front line, building trust and identifying acute needs. Success stories emerge: an elderly veteran connected to his VA benefits, a single mother enrolled in job training, but the scale of the crisis often overwhelms capacity. To make a lasting difference, Mississippi must strengthen its social welfare safety net, ensuring that programs like xylazine and emergency vouchers reach every corner of the state. As we explore the root causes fueling these numbers, it becomes clear that economic, health, and legal factors converge to create a perfect storm. Government solutions in action. Mississippi's state and local governments have rolled out several initiatives aimed at stemming the rising tide of homelessness, each reflecting a distinct philosophy about how best to deploy limited resources. At the forefront is the Housing First model, an approach adopted by Jackson's municipal authorities in coordination with the Mississippi Home Corporation. Rather than requiring individuals to overcome addiction or secure employment before receiving housing, the state provides immediate access to stable shelter, on the premise that a secure home is the foundation upon which other recovery efforts can succeed. Since its pilot launch in early 2023, Housing First sites in Jackson have placed more than 400 individuals into apartments, cabins, and repurposed motel rooms. Case managers work alongside residents to arrange healthcare appointments, job training, and peer support groups. By decoupling housing from behavioral prerequisites, the program has reduced emergency room visits among participants by 28% and improved employment placement rates by 17%. To complement Housing First, Mississippi leverages federal emergency housing vouchers funded through the U.S. Department of Housing and Urban Development, HUD. These vouchers subsidize rents for eligible households, covering up to 100% of a modest apartment's cost in areas where rent burdens are highest. However, the state's allocation of 3,500 vouchers falls short of demand. Waiting lists often exceed a year, pushing desperate families to seek temporary refuge in overcrowded shelters or makeshift camps. In response, state legislators have introduced a bill to reallocate unused or expired vouchers from low-demand rural counties to urban centers like Jackson and Gulfport. If passed, the measure could reduce waiting times by several months and reorient resources toward the neighborhoods most impacted by displacement. A third prong of the government's response involves partnerships with nonprofit organizations to pilot innovative housing solutions. In Gulfport, a coalition of local businesses, faith communities, and housing advocates unveiled a modular homes project in mid-2024. Built off-site in sections and assembled on donated land, these homes can be erected in weeks rather than months, significantly lowering construction costs. The state subsidizes 60% of the building expense, while corporate sponsors cover the remainder. So far, 120 modular units have housed individuals transitioning out of chronic homelessness, with each resident assigned a mentor to support budgeting, job searches, and mental health care. Early data suggests that retention rates, meaning the percentage of residents who remain housed after 1 year, hover around 85%, a marked improvement over conventional shelter placements. Mental health and substance abuse treatment have also become central to Mississippi's strategy. The Department of Mental Health expanded its mobile crisis units in 2024, dispatching licensed counselors and medical staff to encampments, hospitals, and community centers. Unlike traditional ER-based interventions, these mobile teams offer on-the-spot counseling, medication management, and referrals to detox programs. They operate 24/7 in Jackson and 8 other counties, reaching over 2,000 individuals in their first year. By integrating social services with housing assistance, the state hopes to address underlying causes rather than simply treating symptoms. Veteran-specific programs continue to make headway as well. Mississippi Veterans Affairs offices coordinate with the VA's Supportive Services for Veteran Families, SSVF, which offers short-term rental assistance, utility payments, and case management. Since 2022, more than 1,100 veterans have moved into stable housing through SSVF, and outreach efforts have penetrated rural communities where veterans often lack easy access to centralized VA facilities. Peer-to-peer mentorship programs pair newly housed veterans with those who have navigated the transition successfully, fostering community bonds and reducing feelings of isolation. Despite these achievements, obstacles remain. Funding cycles for many initiatives are short, often one state fiscal year, leaving programs vulnerable to budget cuts and political shifts. Administrative complexity and eligibility criteria can deter the most marginalized individuals. Undocumented immigrants, for instance, are ineligible for most federal vouchers, while strict sobriety clauses exclude those actively struggling with addiction. Moreover, the geographic distribution of services remains uneven. Counties in the Mississippi Delta and the Pine Belt region report few housing-first sites and limited case manager availability. To address these gaps, some lawmakers have proposed creating a statewide task force on homelessness. This body would convene representatives from housing authorities, mental health agencies, veteran services, and community organizations to develop a unified data-sharing platform and harmonize eligibility standards. By replacing the current patchwork of programs with an integrated system, the state could streamline referrals, monitor outcomes more accurately, and reallocate resources in near real time. Such coordination would also facilitate scaling successful pilots, like the Gulfport Modular Homes Project, across multiple jurisdictions, ensuring that innovations proven effective in one city benefit residents statewide. Clearly, the government's multifaceted approach demonstrates a willingness to experiment and collaborate, yet without sustained funding and a cohesive strategy that spans all 82 counties, progress risks stalling. As we look beyond these policies, it becomes crucial to imagine long-term solutions that not only house individuals but also tackle the root causes perpetuating homelessness across Mississippi. Future directions and long-term strategies. Looking ahead, Mississippi's path to reducing homelessness must extend beyond immediate shelter and transitional programs to embrace systemic reforms that address housing supply, economic opportunity, and preventive social services. At the core of this vision lies the expansion of affordable housing stock through both public and private investment. State officials are exploring tax incentives for developers who set aside a percentage of new units for low-income renters, an approach that has proven successful in other southern states. By offering property tax reductions and low-interest loans, Mississippi can encourage the construction of mixed-income developments in urban centers where rental markets are most competitive. Complementing these incentives is a proposal to overhaul the zoning code in major municipalities. Current regulations often impose minimum lot sizes and single-family mandates that limit multi-unit construction, a barrier to dense, cost-efficient housing. Pushing for inclusionary zoning reforms, such as allowing accessory dwelling units, ADUs, and duplexes in neighborhoods previously zoned exclusively for single-family homes, could unlock thousands of units suitable for individuals and small families. Such measures also align with conservation goals by reducing urban sprawl and preserving farmland on the state's outskirts. On the economic front, Mississippi must bolster workforce development programs that connect homeless and at-risk populations to living wage jobs. Partnerships between community colleges, technical schools, and employers can create tailored training tracks in high-demand fields like healthcare, advanced manufacturing, and renewable energy. Pilot programs in Jackson have already enrolled 200 participants in certificate courses, with a 60% job placement rate within 6 months of graduation. Increasing funding for supportive services, such as childcare stipends and transportation vouchers, would further remove barriers to completion, ensuring that training translates into stable employment. Preventive measures are equally vital, operating upstream of homelessness. Community-based interventions can identify families at risk due to sudden income shocks, medical emergencies, or domestic violence. A proposed rapid response fund would grant cash assistance of up to $2,000 per household for rent arrears, utility bills, or emergency repairs, effectively plugging financial holes before eviction becomes imminent. Local nonprofits and faith congregations could apply for sub-grants to manage these funds, leveraging their community ties to reach those most in need. In tandem, outreach workers would conduct home visits to connect families with ongoing support, food assistance, medical screenings, or child welfare services, thus preventing a temporary crisis from escalating into chronic homelessness. Healthcare reform stands out as a critical lever for change. Expanding Medicaid under federal provisions would enable low-income adults to access mental health and substance abuse treatment without cost barriers. Although Mississippi has thus far resisted expansion, a growing chorus of legislators, business leaders, and health advocates is pressing to override this stance. If successful, Medicaid expansion could link thousands of uninsured residents to preventive and behavioral health services, reducing the number of individuals who slide into homelessness when medical bills become overwhelming. Criminal justice reform also intersects with homelessness prevention. Currently, many individuals released from jail or prison lack housing plans or support networks, increasing their vulnerability to street homelessness. Establishing reentry collaboratives that coordinate between correctional facilities, probation offices, and housing providers can ensure that every returning citizen has a transitional housing slot and access to job counseling. Pilot efforts in Hinds County have shown promise. Recidivism rates among participants dropped by 20%, and housing stability improved markedly. Community engagement and public education round out the future strategy. Sustained anti-stigma campaigns, featuring voices of formerly homeless residents, can shift public attitudes from blame to empathy, fostering a political environment conducive to investment in social services. Schools, civic clubs, and local media can amplify these narratives, framing homelessness as a solvable challenge rather than an intractable social ill. Viewed through the lens of a travel documentary, Mississippi's effort to combat homelessness becomes a story of transformation, one that invites viewers to witness not only the struggles, but also the courage and creativity emerging from the state's towns and backroads. By sharing these experiences on screen, we can galvanize broader support and spark conversations in communities far beyond the Magnolia State. As we consider these long-term strategies, it's clear that sustained political will, cross-sector collaboration, and a commitment to preventive measures are essential ingredients for lasting change. With this foundation in place, Mississippi can chart a course toward housing security for all its residents and inspire other states grappling with similar challenges. Conclusion. By expanding the housing supply through tax incentives and zoning reform, strengthening preventive supports that catch families before they fall, and reforming healthcare and criminal justice systems to promote stability, Mississippi can redefine what it means to care for its most vulnerable citizens. This is not merely a policy challenge, but a moral imperative, a test of whether the state will choose to honor its tradition of hospitality with concrete, equitable action. As the sun sets on yet another day in communities from Jackson to the Delta, the question remains, will we allow the Magnolia State to become a travel documentary of neglect? Or will we instead craft a new narrative of hope and resilience that resonates across America?